Greetings to the Acupuncture Promotion Society. I'm happy to visit you once again, this time via videotape so that I can record this while the sun is on this side of the planet rather than on your side and I'm sleeping. So this is a little more convenient for both of us, and all you have to do is look at it online, and we got it taken care of. If you do find that you have any questions following this little lecture, you can give those questions to Sarfraz and he can email them to me and we can interact like that. I think that would be great. I'd be more than happy to answer questions as best I can. This 20-minute lecture is all about pain. What I want to mostly focus on are mechanisms, causes for pain, and diagnostic criteria so that we know what kind of pain we're dealing with, and when we understand the kind of pain, we can pretty much just know how to treat it. If the pain is due to cold, we add heat, for instance. So, and the noises you're hearing is my herbalist behind me that's working on some formulas right now. And hey, Sine, why don't you wave to the people? There we go. All right. All right. So we begin with where does pain come from? According to Chinese medicine, it really just comes down to a lack of nutrition to particular structures, and when those structures don't get the adequate nutrition, they hurt. I looked up the Western mechanisms, regarding nervous system and different spinal tracts and different types of nerves and where they go to different portions of the brain, and I couldn't really find too much resonance. Sometimes you can say this thing in Chinese medicine is exactly like this thing in Western medicine, but with pain I really didn't find that. However, say that a lot of times, for instance, myocardial infarction, a heart attack, that pain arises from ischemia to the death of certain cells, and I think that comes closest to the Chinese medicine notion of structures not being nourished. And with that, we'll get into different reasons for this lack of nourishment. Two, basically. One is excess, one is deficiency. The causes for excess's cause of pain is generally there's something that's obstructing the flow of qi and blood to a given structure or to a part of the body, and that generates the pain because downstream there's no nutrition. It's like a rock in the middle of a stream. The water gets backed up and it can't go down and nourish the crops or whatever else is downstream. So the deficiency kind of pain is much the same, but instead of a rock, the stream is dry. In both cases, downstream, we have a lack of nutrition or nourishment to the field, in this example, but in the body to different structures and so forth. So how do we know if the cause of the pain is due to excess or deficiency? We'll get into that a little bit from now, but for now I can tell you the key issues you'll want to watch out for are pathogenic factors like cold can get into the body, damp and phlegm, which are generated from the earth element, the digestion. Those can start clogging things up. Let me go to my notes here. Here we are. Food stagnation can cause pain, so if the food is difficult to digest, if your digestion is weak to begin with, either one of those, the pain that arises from the stomach can be significant. Qi stagnation is usually aggravated by emotional stress. It can also apply to the premenstrual period, so we can call it hormonal as well. And blood stagnation arises from a few different causes. One of them is qi stagnation plus time, and the other is tissue trauma. If you have an accident, if you break a limb or something, it's going to hurt. That's tissue trauma. We consider that blood stagnation. As I mentioned, cold can get into the body and it can hurt as well. We have this idea in the West called brain freeze. When you drink something really cold, like a chocolate shake, an ice cream shake, or something like that, it makes your head ache all of a sudden. So cold has that possibility as well. Or if you live in a cold climate and you go outside for a long time, growing up in a cold climate where I was in the middle of the country in Nebraska, where we have winter, real winter, we would come home from school and I couldn't feel my hands, which did not hurt. But when they started warming up, it was just tremendously painful to feel the cold get out, and that was always a problem after having fun in the snow all day. Deficiency causes for pain. As I mentioned a few moments ago, the type of pain you'll get from deficiency is called chronic and lingering. So it comes and goes kind of slowly. It may not be very intense. It may be low grade, but it's long lasting. It takes forever to fix. It takes forever to come on. It's a very long lasting thing. Whereas the excess types of pain come and go rather quickly. Deficiency can be just about anything. Jing, essence, yin, yang, qi, blood, anything that causes a lack of nourishment in the structures, whether that's the muscle, the bone, tendons, anything can generate pain in that regard. So the first thing we want to do diagnostically is know the history of pain. Did it suddenly arise? Was there a very specific event that brought it on, like something falling on your head to cause a headache? Or is this headache, for instance, kind of chronic and has been going on for weeks or months, and it's low grade? That might indicate a little bit more of a deficiency situation. The diagnostically different causes of pain produce different kinds of pain, and I'm going to go through some of those right now. Distending pain is a pain that causes the structures to feel large or bloated. We often apply this to the idea of abdominal bloating and discomfort there. That is oftentimes due to qi stagnation. And what I find, we have a term for this. It's called dull and radiating pain. Pain that is dull and radiating. Kind of the opposite of that is blood stagnation, which is defined as sharp and fixed. Sharp means it's like a really small little point that hurts really bad. And then the fixed location means it's always in the exact same spot. So a good example of this is with dysmenorrhea, painful periods. When I ask a female patient who complains of this condition, where does it hurt when there are cramps? What kind of, where does it hurt? There's going to be two responses. They will either take one finger and point to one exact location in the lower abdomen below the shot here, and they'll say it hurts right here. Every single time. That's blood stagnation. However, if they take an open hand and say it hurts in this area, that's qi stagnation. So qi stagnation is dull and radiating, a little hard to fix in an exact location. It's a region. Whereas blood stagnation is really easy to locate. It's sharp, fixed, and right there. All right. So that's one diagnostic item to keep in mind, is dull and radiating for qi stagnation, sharp and fixed for blood stagnation. Let's see what else we got here. Blood stagnation can, let me return back to qi stagnation, especially in the abdomen, coming up a little bit above the dysmenorrhea issue. Often happens that people get bloated and it hurts. It can be very painful. If that pain is relieved by gas, that's commonly qi stagnation. If the pain is relieved by belching, if perhaps it's a little bit more in the stomach, that again is qi stagnation. Qi stagnation that is unchanged by any other complications generally gives rise to flatulence, gas, or belching with little or no odor. It's a large quantity but very small odor. And that's a key indication, key diagnostic indication for qi stagnation, is that lack of odor. With flatulence, there's a few different odors you can run into, and I'll tell you the other ones really quick. The odor that smells like your regular poop is, it's probably just normal. We all poop, we all let out a little gas every day. If it becomes significant and it still smells like your regular poop, then consider spleen qi deficiency as the cause of this. The other kind of gas that we run into is actually two others. One is kind of common. As children in America, we referred to this kind of gas as silent but deadly. And what that means is a very small quantity but very strong odor. And it may, in fact, cause some burning sensation in the anus. This is, from a Chinese standpoint, generally heat, often damp heat, because it's part of the digestive system. And whenever there's any problem in digestion, the outcome is probably going to include some dampness. If it is associated with yellow, explosive diarrhea with a strong odor that may burn the anus, that's just a confirmation. But the gas that precedes that is silent but deadly. Small quantity, very strong odor. Other kinds of pain, well, that's chi stagnation, the belching and the gas, very little odor. With the belching, if it has a strong odor, consider food stagnation. The food is sitting in the stomach and it has a very sour flavor to it. So the belching, that is. As I mentioned, blood stagnation is sharp and fixed. Colicky pain is a kind of pain that indicates a twisting sensation. And in general, this is due to cold. Cold tends to constrict and contract structures. When you get cold, your body tightens up and you shiver. That tightening up and getting hard is kind of how the channels in the body, the acupuncture channels, even the blood vessels, all respond to cold. And when they seize up like that, then the chi and blood can't flow, and structures downstream from that, it may be very close to the location of the cold or it may be further. Either way, it's going to cause pain downstream. And that pain could potentially feel twisty or pulling. And that's one thing to keep in mind about internal cold. Other indications would include a blue hue to the lips or the tongue, and perhaps a history of exposure to cold weather, that kind of thing. Migrating pain, run into that quite a bit, kind of common in arthritis. Migrating means movement. The pain is here one day, then here, and then over here. And it goes all over the place. Hard to fix in a particular location. So just like in the body, wind tends to move, and that's kind of its nature. It has to move. If you have still air, there's a lack of wind, So when we see movement of pain that's moving all around, we assume there's some wind involved. Wind is often a carrier for other problems. The most common presentation of arthritis that we tend to see is wind plus cold and damp to one extent or another. So wind gets it into the body, but what usually causes more problem is the coldness or the dampness. And how do you know if the arthritis is due to wind, cold, damp? Because it's aggravated by cold or damp weather. It's really easy. And then you know what you're dealing with. You use moxibustion for the cold and acupuncture for the damp. I myself focus on herbs. There's a common formula for this called Du Ho Ji Sheng Tong that we apply to this kind of condition. So that's migrating pain. Retraction pain is due to the tendons in particular not getting enough nutrition. So what does retraction pain feel like? It's a pulling or a tight pain. And I think it would be worthwhile to say that if you're an athlete and you're trying to stretch out and it really hurts, that's getting close to retraction pain. And if that is a condition that one runs into quite often, the goal would be to nourish the tendons. Which organ governs the tendons? And that's the liver. Which organ stores the blood? The liver. And so a lot of times what we want to do is focus on the liver in regards to nourishing the tendons, whether that's blood or yin, one or the other. And the quickest way to determine whether the liver needs blood or yin is by looking at the color of the tongue. If the color is red or a deeper color, consider that a deficiency of yin fluids. If the color of the tongue is pale, then you're probably dealing with a blood deficiency, and you'll want to look at that. So that's retraction pain. I don't hear about that too much in the clinic, but I can see how athletes or anybody who feels like everything's tight and they just can't loosen up would benefit from that kind of approach. Scorching or burning pain is when pathogenic heat attacks the channels, and oftentimes we'll see other indications such as swelling and red joints. This is common with some kinds of arthritis as well. And we'd want to get rid of the heat, obviously. Acupuncture at the yin string points, the second points up from the yin channels, are often used to reduce heat from the given channel. So if the pain or the redness and the swelling is on, let's say, the stomach channel, you'll use on the foot, the second from the last point, which I believe is it stomach 44? Do you remember, Sine? Stomach 44 is the yin spring point of the stomach. You don't know? I don't know either.
I'm not there yet.
She's not there yet. She's a student. All right, and but we want to clear the heat from the channel, depending on where the heat is found. Local points are always good as well, as long as the patient can take it. You don't want to further traumatize the patient with too much pain by sticking needles directly into what hurts. Cold pain is just like heat pain, only it's aggravated by cold and helped by warmth, and much pain is just exactly like that. So we want to keep that in mind. Cold in the channel responds well to warmth. Cold internally, if it's in the Zong Fu organs, can be extremely excruciating. One definition of cold pain is intense. And I've seen people with cold in the middle, spleen, stomach, and they come into the office doubled over. They can't even stand up straight. Remember, cold contracts. And if you see someone who's contracted at the middle by bending over, you might, at least add that to the possibility of the diagnosis is internal cold right there and then. In which case we use interior warmers, futsa, aconite, that kind of food, that kind of herb, or moxibustion, commonly placed on the umbilicus, on the navel, the belly button, with shengjiang, a slice of ginger, maybe something like that on there. Very, very positive, very effective. There's a very important kind of pain called heavy pain. And this is not something that patients in the West usually complain of because it's not in our minds to think of it as such. And so you have to ask, do your limbs feel heavy? Or you'll find them kind of slumped over, or maybe they're overweight. You can tell there's a lot of phlegm damp accumulation there already. But damp pain, as a rule, especially when it's in the channels, is typified as a sensation of heaviness in the limbs. It's a heavy pain, a dull, heavy pain. Now that's in the channels. When we're talking about the Zong Fu organs, we have other symptoms like nausea, diarrhea, other problems. Let's see what else we have. Hollow pain. Again, this is something that Western patients don't often articulate per se because we don't think of it as such, but sometimes headaches, for instance, have a sensation of emptiness in the head. And this can be due to a deficiency, obviously, of qi, blood, yin, yang, jing, essence. But that's sometimes hard to determine. What is an empty pain and what is a full pain, at least on the part of the patient. So the more pain that you as a practitioner can experience, the better words and ways of asking you can find of your patients. And that's always the upside to experiencing pain as a doctor, is you have more compassion for the patient, but you also have a better vocabulary. Does it feel like there's sort of right here, you can better articulate things. So that's an upside. And finally, there is the so-called aching pain, which is defined as a pain that's associated with fatigue or weariness. And this is common in the low back, especially with kidney deficiencies. And it can be a deficiency of anything: jing, blood, yin, yang, qi. And kidney blood, I don't actually think we run into kidney jing more often. But all the same, if you get pain that's worse at the end of the day and associated with fatigue, consider a deficiency syndrome if it's aggravated by fatigue. And if it's low back pain or knee pain, then you'll want to take a look at the kidneys in particular. So it's been about 20 minutes, and I've gone through the various different types of pain and included some really important information on the smell of gas, which we should all have and nobody wants to talk about. So that's my 20-minute talk for today. And like I say, if you have questions, please send them to Sarfraz so he can send them to me. And until then, I wish you all very well, and peace be with you.